Varkentje. Ja. Varkentje. Yeah.
This is an older boy who's also who has some language already. He has to imitate what is drawn, but we remove the point of his pencil. So he has to ask, he has to learn to make eye contact with the therapist and to ask to get a new pencil because he cannot imitate the drawing this way. And so on and so on. So we have 4 of these kind of activities in every session. What is measured afterwards, in quite some detail, is gestural imitation, verbal imitation, procedural imitation, or imitation with objects, symbolic imitation, and spontaneous imitation. And we also measure reaction to ambiguous behavior, initiating, requesting joint attention, gaze following, initiating declarative joint attention, and spontaneous joint attention. These are the results. For imitation, we were not able to demonstrate a significant difference between the 2 groups. And one of the reasons is that the control group also improved, and that probably because in the treatment, as usual, imitation is also a focus of treatment. But we were able to find a significant improvement within the experimental group. When it comes to joint attention, there was a significant interaction, and the treatment group or the experimental group improved significantly more than the control group. And when we looked in more detail, we saw that following declarative joint attention, initiating, requesting joint attention, and especially, and we're quite happy about it, spontaneous declarative joint attention behavior improved significantly. This is initiating declarative joint attention. It went down. The reason for that is we measure this with an unexpected event that occurs. For example, a movie starts on a video screen, etc. And we think that children were getting used to these unexpected events and were not so interested anymore to showing them to the adult. As for imitation, especially imitation with actions on objects and symbolic imitation improved significantly in the treatment group. We also developed a similar program for parents, and it's only in its pilot phase, but I thought before I finish for this Congress I would say something about it. We have now worked with 4 families with children between 3 and 5. We used identical measures as in the other study. The treatment was carried out for 10 weeks, and parents had 3 fixed, you can say, at the table exercises, and 3 more flexible naturalistic exercise moments every week. And of course, these are very preliminary data, but it seems as if, especially for joint attention, we were able to get some improvements. We saw that teaching gestural imitation was most difficult for parents. If we asked them, this was of course very closely monitored, parents say, it's pleasant and interesting to do this, it's certainly worth the effort, and they had no problems in following the sequence of the manual. So we think these are quite promising results after a relatively short intervention, and the training program appears to be a valuable addition to regular treatment. And it's important that it generalized to non-treatment providers who were doing the pre- and post-evaluations. We are now collecting follow-up data. They seem promising, and we think the pilot data of the parent-mediated program are promising as well. For the moment, we are carrying out a large-scale study, including also younger children with ASD from the age of 2 onwards. It's not always clear what works in intensive eclectic interventions for young children with autism spectrum disorder. And in many cases, and I guess in many countries, it's not possible to have very intensive interventions. Also, we see that in some cases there is a risk for some kind of burnout, both in the children and in the caregivers. I think it's important that we develop relatively small, well-focused, evidence-based modules. And I also think it's very important that we include parents in all these efforts, as also Dr. Roeyers said in the previous presentation. And I hope that if we continue this research, not only in our lab, but in a lot of labs in the world, that we will hopefully be able to improve the quality of life of children with autism spectrum disorders and their families. Thank you.